So during ESTRO 2022, we also perform a presentation on radiotherapy in patients receiving anthracyclines. That was a subgroup analysis of the phase 3 SAFE trial from the interim analysis of the trial that was presented in San Antonio last year. Basically, we know very well that there are several studies that evaluated a cardioprotective strategies to prevent myocardial dysfunction in patients receiving anthracycline or cardiotoxic therapies. Currently, echocardiography is considered the gold standard in cardiac imaging of patients during and also after cancer therapy. And we know very well that the remodeling that precedes the ventricular dysfunction and the reduction in terms of global longitudinal strain seems to be nowadays the most sensitive parameter to predict an early cardiotoxic effects. Basically, ACE inhibitors and beta blockers have been shown to prevent cardiac remodeling and reduce mortality in patients with cardiac dysfunction, and have been proposed by most of cardioprotection guidelines in oncology. The SAFE trial basically is a 4-arm randomized phase 3 double-blind study aimed to determine whether a pharmacological cardioprevention could indeed reduce a subclinical heart damage in breast cancer patients receiving an anthracycline-based chemotherapy. We analyzed patients that receive radiation therapy within the SAFE trial. What we basically observed, that no significant correlation between heart and heart substructures parameters exists with subclinical heart damage at 12 months. This was made for heart, for lead, for left and right ventricular substructure, for left and right atrium substructures. So basically, at this pre-planned SAFE trial interim analysis, a cardioprotective pharmacological strategies in patients affected by breast cancer receiving an anthracycline-based chemotherapy protected against cancer therapy-related decline in terms of left ventricular ejection fraction at 12 months. However, no specific radiation therapy dose constraints for heart and cardiac substructures related to subclinical toxicity was identified. Basically, the only independent predictive factor of significant global longitudinal strain and global longitudinal strain or three-dimensional left ventricular ejection fraction worsening more than 10% was represented by the placebo arm of the trial, thus basically confirming the crucial role of a pharmacological protection for patients affected by breast cancer receiving an anthracycline-based chemotherapy, regardless of postoperative irradiation. That was the main issue of our subgroup analysis.